Dr. Clinton, I went into this facelift with a bit of trepidation because I happen to have a job where I'm on camera a lot, and I had started noticing some things that bothered me, but I felt some guilt about coming to a plastic surgeon. Didn't know if that was something I needed to do, but it bothered me. So when I had my first consultation with you, I just want to thank you for how you put me at ease and how you immediately made me feel that my questions were fine, that my questions were normal, and that what I was looking into was something that many women look into, and that it's okay. Because there are a lot of voices out there, and I'm glad that I found you and listened to yours. You've done this for so long, and you do a beautiful job, and I feel like finding you was the best part of the process.
Well, that's great to hear, and you touched on something that I think is so very important, and that is most all of our patients that we see are looking for someone to validate their decision to even investigate it, even to come and sit in my office. They kind of want to know if it's okay or not. And I could tell that when we talked that you had at least average, maybe even above average skepticism about the whole process. I mean, you're a very attractive lady already, and you're kind of going, am I being a little bit greedy here? You know, I mean, all kinds of thoughts that are going through that. You've asked as many questions as anybody I have ever consulted with. And I grew to really have a lot of respect for you. I mean, they were very relevant questions, and it really put me to the test, you know, on that. But I could tell that you were going to need an extra special effort to reassure you that even the process of considering this was okay. So you weren't impulsive about this. Don't really like people to be impulsive, like I decided to do it yesterday and I got to have it done today. No, you very thoughtful about the process, and I appreciated that. So that's been a joy. That's been a joy to work through the initial decision, through the consultation process, through the procedure itself, and through the recovery. You know, most people think, well, you know, the procedure is the most important thing. No, I would tell you that what you so artfully did on the front end, and then the fact that you followed recovery instructions so well, I mean, that makes me sleep better at night, and it also makes me feel like, you know, she's going to have a chance to get a spectacular result because of her approach to this. So, yeah, that was good.
Okay, Dr. Clinton, since I've had time to recover and now I have the full results of what you did, I have to tell you that probably the biggest compliment to you, and it's what I hoped for, is the people who know what I did, I had to tell them. And I actually had a friend who is in retail, and she sees women come and go every day. And I told her, and she said, Jamie, you're the first person that I want to go to your doctor because you're the first person whose facelift has ever made me want to do one, because you look so natural. Because we've all seen bad results, and that's part of the trepidation, I think, for many women. And I honestly could not be happier. I truly feel like it's a compliment when I had to tell my best friend. She did not. She never figured it out. And that is what at least I wanted. I just wanted to look like a better version of myself, and you are a master at that.
That is great to hear, and to be honest with you, that's why I do what I do every day. That's what makes it worth getting up in the morning to do this.